Now a word from our sponsor, BetterHelp. For a long time, I suffered with depression and anxiety. I had tried therapy before, but struggled finding a therapist I connected with until I found BetterHelp. That's why I am so excited to share BetterHelp's mission to make therapy more affordable and more accessible. Because finding a therapist can be hard, especially when you're limited to the options in your area. BetterHelp is a platform that makes finding a therapist easier because it's online. Remote therapy sessions, and by filling out a few questions, BetterHelp can match you to a professional therapist in as little as a few days. It's easy to sign up and get matched with a therapist. Click the link in description and receive 10% off your first month of BetterHelp. And by clicking that link, you support this channel. Plus, you can easily switch to a new therapist at no additional cost without stressing about insurance, who's in your network, or anything like that. I was struggling for a long time, and BetterHelp was where I found my therapist, Whitney, who I still see weekly for almost 2 years now. So, if you're struggling like I was, consider online therapy with BetterHelp. Click the link in description or go to betterhelp.com/altereagle. That's betterhelp.com/altereagle. There's no better time than now to start your mental health journey. Thank you again, BetterHelp, for supporting this channel. Good morning and welcome to another episode of Alter Eagle Podcast. I am your host, Lara Craigo. I'm excited to be here with you today because we are just on the brink of October 1st, and October is turning into one of my favorite months out of the year for many reasons. One, I'm really into Halloween, so love Halloween, love dressing up, but sweater weather. I don't know about you, but I get really excited for sweater weather. So here we are. Sweater weather's upon us. For those pumpkin spice people out there, congratulations, your time has come. For the apple picking, apple pie people, it is here. We are in it. For the Halloween people, yes, absolutely. But more importantly, to bring focus to part of our conversation today, October is also Breast Cancer Awareness Month. And we're going to notice a lot of pink popping up. And what I love is that we see pink popping up in the NFL. And I love that we have gotten to a place where we're really bringing so much focus to it. The philosophy that I have lived by with this podcast, which is why sometimes I think I make Tammy really nervous. I have these ideas and I'm like, okay, I have an idea. And she always gives me this look. She's like, okay, what now? And I'm like, just trust me. I have an idea. This is what I'm thinking. You know, the last, I'd say probably month or two, I've been a little bit more like, flighty with who I'm talking to because I've had a little bit of a struggle with locking down some interviews. And I don't know if it's just the time of the year or if I'm being tested or whatever it is. But I'm the type of person that just says, well, I'm going to figure it out. I'm going to figure it out and I'm going to get something out and that's what we're going to do and it's going to be okay. But the other side of this conversation too is hearing from all of you. I'm moving into some women-focused stories here in October, which might slide into November a little bit. And then I'm sliding into education for a bit. And if you are an educator, if you're anywhere out there in the world, or here in Butler County, or you know someone that's an educator that you think should come on as a guest, I want you to send me a message. 2 ways. Instagram, follow Alter Eagle Podcast, send me a direct message through that. The second way is to just directly email me. Lcrago, Lcrago, @butlereagle.com. BUTLEREAGLE.com. Send me a message. I had a lot of thoughts over the weekend of the conversations I want to have, and I want to hear from you. I want to hear who you are, what it is you're going through, what your dreams are, what your goals are. I want to hear about your struggles and how you've overcome them or how you are overcoming them. And I just want to know what it is that you are grateful for in this life, because if there's anything about today's episode, it is a reminder for us to be grateful. And dogs really teach us how to just be grateful and be happy. And I'm really excited for you to hear this episode. So let's get to it. Make sure that you are following us on social media just so you can stay up to date with some things I'm doing. This episode is brought to you by R.W. McDonald & Sons Incorporated, Robert Stevens Jewelers. Thank you to our sponsors for your support on our first season of the Alter Ego podcast. To your point of, October's coming up, breast cancer awareness, and we notice, like, during the month of October, we see pink everywhere, right? Even in the NFL. So we were talking about that. But a point that you made is that we don't really see that for other cancers. I mean, they do have, so September is like, to my knowledge, I know with Alex's Lemonade Stand Foundation is like a big September's Childhood Cancer Awareness Month. It's sad that we have to have these months, right? Where we have to really kind of push to keep that momentum going throughout the year for, fundraising for research and, getting people the care and the treatment that they need. Because let's be honest, when we're talking about medical expenses, I don't know if anyone spent a night in a hospital or taken a ride in a ambulance. It's not cheap. But those people, what they're doing is they're putting their lives on the line to save other people. So we need to figure out a way where we can help people who are finding out. Another point you made was someone retires and then they find out they have cancer. And I think you experience that a lot with what you do. So why do you think it is that we don't have, every month isn't dedicated to, because how many different types of cancer are there? I mean, I know that's like
there's a lot.
There's a lot.
And sometimes I'll see one and I'll be like, man, I didn't even know that existed. But there really is a lot of cancers out there. Mm-hmm. One of the ones that stick out to me that I wish we had a special event for is pancreatic cancer. I see a lot of pancreatic cancer. It's a very sad cancer. It's aggressive, mm-hmm. and people's lives change very fast. But we don't really celebrate it. Celebration's kind of a weird thing to say, but we don't. But the awesome part about support services at Independence is that we may not celebrate it, but we take care of every individual in our community with any kind of cancer.
Yeah.
So that makes me proud.
Yeah, as it should. I'm sitting with Stacy Meyer. Thank you for coming here and meeting with me.
Thanks for having me.
Yeah. We've been having a wonderful conversation, talking about a lot of different things. Stacy lives in Evans City, so we're neighbors. We just found this out. And she told me that she has some farmland, and she has a duck that doesn't like to get in the water, which I think is hilarious. He's afraid of the koi fish.
He's afraid.
That's just funny to me. I don't know why. I love that. I need to meet this duck.
He's adorable.
Yeah, I bet he is. And some other animals. She lives with her husband, John, and her daughter, Lucy, in the country, being surrounded by all of God's beauty. She says that she comes from a family of 7, and family is the utmost importance to me. And she treasures her family, and she doesn't know what she would do without their love and support. You graduated from Slippery Rock University with a bachelor's degree in social work. You were employed as a medical social worker for Butler Memorial Hospital for 21 years in the acute setting. And now you continue to work for the health system, but in a different capacity. The oncology patient navigator, currently working with radiation and chemotherapy patients for UPMC Hillman Cancer Center at Independence Health System. God bless you, because we need more people like you in this world.
Thank you.
Okay, so we met because I really wanted to talk to someone who works with therapy dogs, which I think is so cool. I tried to take my dog through the training because I thought he loves little kids. And I was like, how cool would it be if I could get him certified and, look into a program at Children's and go down there and take him on a Saturday or something and just do it part-time, just like volunteer. And there were 2 things he couldn't pass. He couldn't pass when they made the loud noise, when they dropped something.
Oh, yeah.
He would jump, and he's a little guy. He would jump, and I think if I worked with him, he's really smart. He could get it, but it would take a lot of diligent work, obviously, on my part. And then the second one was whenever we would stop, with another owner with a dog, he would sit at first, but then he would do that thing where he'd start pawing at my leg. Because anytime I have a conversation with someone, Bear needs to be involved in the conversation. He has to be a part of the conversation.
Sure.
Because he's so little, he can't hear from down here. Now, I've spoiled him, and I've created that myself, because then I started picking him up. So now it's like a thing. If I'm on the phone, he's not having it. I have to pick him up, and I pick him up, and he does this thing with his head where he goes like this. And then he's fine. I was like, oh, you're fine now. Now you're fine. Now that I've picked you up, and I did it. It's my fault, but I'm okay with it. So he's a sweetheart, but it's a lot of work. Tell me and tell our listeners a little bit about Henrietta.
Well, Henrietta's my girl. I love her to pieces. And Henrietta was purchased by one of our cancer patients' wives, and she thought that our cancer patients needed a therapy dog. So that's how we purchased Henrietta. So Henrietta is an employee of Independence Health System, and she is a real lover. We went to school. I called it dog school. And I have to tell you, I think I was in boot camp with Henrietta. I didn't think I'd ever get through it. It was a rough road. And but I took her to work with me as soon as she was a puppy. As soon as I had her potty trained, I wanted her to get used to the environment. So believe it or not, the staff think she's their dog too. I mean, she's been there forever, and I wanted her to get used to the environment. But technically, you can't be a therapy dog till you're at least 1 year old. So we did some training through Butler Dog Training, and she was too young to get certified, or we got our little certificates, but it wasn't real dog school.
Okay.
Then when she got old enough, we went to boot camp. And my trainer, we had one-on-one training, and I didn't think I'd get through it. I used to shed a few tears a couple times a week, and my trainer kept saying, Stacy, not every dog can be a therapy dog, and we won't know until we work her. So we would go twice a week as a family, and we would I was the guinea pig, of course, since I'm her trainer. I had to do all the work, and my daughter and husband would sit and sort of be my cheerleader. And Henrietta was slow at it, but she got the point, and you have to see her now. She knows her job.
You said that one of the things she does is does she sit by the elevator, and as soon as someone comes out, she's up there greeting them, saying hello to them, and she makes sure that she sees everyone. So she gets to everybody.
She doesn't necessarily sit at the elevator. We'll be sitting with somebody, a patient or a family member, but she's constantly watching that elevator door open up.
She's just like waiting.
Yeah.
That's her job.
It's her job.
Oh,
and she'll start pulling me, and I'm thinking, what the heck is she pulling me for? Next thing you know, the door's opening, and she knows. I mean, it's unbelievable. She knows someone's coming.
Dogs are just so amazing.
Mm-hmm.
I mean, we've seen it throughout history, right? They even have, they have canines for, police forces. They've got, in New York, I know they've used it in, emergency situations to find people.
Unreal. It's
unbelievable what, dogs are capable of doing. And I think they can teach us a lot because they are forgiving, right? They forget immediately you walk through that door that you've been gone all day. They're just happy to see you. Mm-hmm. And it's just such a lovely thing to come home to. Like, I love coming home to my dog, and I always do this thing where I'll pick him up, and I'll be like, I missed you. Of course I missed you. I always say that to him, and he puts his little, when I say that, he like puts his little head right here, and I'm like, and I hug him. I'm like, buddy, I was like, it's so good to see you. I missed you today.
Well, our patients are that way too.
Yeah.
And they'll be like, where have you been? I think they forget that I have a job to do. Yeah. But I try to get her out and about as much as I can, depending on the day and what I have going. But everybody wants a piece of Henrietta.
I bet.
And it all starts from the car. I mean, as soon as we get out of the car, people in the parking lot, oh my gosh, can we see your dog? And So I try to remind everybody who she belongs to, why we're there. And I mean, when people come to the doctor's office, they do a double look like, is that a dog? Like, is there a dog here?
Yeah.
And Dr. Anya Frey, our radiation doctor, he will actually say, Stacy, we got a patient in the exam room. Go head in there and introduce him. And he's real big on getting her to the patients. It's
That's
precious.
Wonderful. Yeah, that's wonderful. Well, that was one thing we did kind of talk about. If you're comfortable talking about it, when you first approached, so you approached Butler Health Systems whenever you had the idea to bring this program there, that you were nervous, right? Because obviously a lot of people associate dogs with disease, and we're talking not germs and we're talking about oncology patients
Right.
specifically. So that's a especially a department where we want to make sure that it's like germ free. Like, so how was it that you got up I don't know. I always talk to people about their energies. I hope that's not weird. She has such a kind and like warm and just like friendly. You just have like a really great, I don't know.
Well,
I don't know what else to say. You have such a good, just like, you smile. The first time I met you, both were smiling and you stood up. Melissa's also in the room with us. She didn't want to be on a mic. I'm going to go ahead and just give her a shout out. She's over there off camera. She's here to support Stacy. But yeah, I love your vibe, and it just makes sense, If I was looking to get into a career and I was like, I want to work with therapy dogs, I would be like, can you teach me? Would you be like my mentor? You'd be a wonderful mentor for...
Oh,
so
you're very kind.
I feel like that's something you need to maybe put in your back pocket.
Thank you.
If it's not already there.
Well, my job, I always say it's not a job. It's a part of my life.
Yeah.
And I think Henrietta's catching on to that too. We go to work, and our job is to help people, make people feel comfortable, and let them know we're on their side.
I love that. So it's wonderful that you took the initiative to approach the, Butler Health Systems about this program. And how long would you say, we talked a little bit about that from like that initial conversation, if you were to guess, was it to where you started like actually working into this process, and then the patient who purchased Henrietta for you all, how long do you think that was?
Well, believe it or not, at the time we were Butler Health System. Now we're Independence, but when I first approached administration, I would say maybe 6 months, and maybe less. I don't even really remember, but it took a while because I had to write a proposal, and not only did it go to our administration, but it went to our legal team, and wanted to make sure that we thought of everything before we brought a dog into the cancer center. And so it was a process, a big one.
Yeah. Were there any other like programs like in the state or the country that maybe you looked at and sort of asked for advice on that? Or were you just like, I just
jumped in.
You just jumped.
That's kind of what I do.
She didn't dip her toe in the water.
No.
She went right up to the high dive and was like, and
I did. I really did.
I love that.
I made a phone call to actually Dr. Savaji, and I asked her if she thought it would be a crazy idea to write up a proposal. And she said, I think it's a great idea. And
I love that.
So that's what I did. I wrote a proposal. It even had to go through our infectious disease department for them to look at it. I mean, she truly, we crossed every T and dotted every I to make sure that we could do this appropriately.
Yeah.
And so we did. And Henrietta has, she has to work with me for 7 years before she's allowed to retire. And she is an employee. She even has her own name badge. And
I think that's so great.
And I pretty much only take Henrietta on work-related, how do I want to say it? I don't take her to other areas. I mean, I can't,
Okay.
a lot of times people say, would you bring her to our preschool, or would
Oh,
you consider, somebody passed away? Would you come and meet the family with her? And I try to keep her work related. She belongs to the health system, so we only work for the health system.
yeah.
And then that way it doesn't confuse her with her job. I
Of
mean,
course.
she knows her job.
Yeah.
And it's with cancer patients.
Yeah.
We really don't go outside of the realm.
I wonder if there are, and I'm sure there are organizations or people who have therapy dogs that do that do provide that service. I'm
They
sure.
do.
Yeah.
They do. Where Henrietta and I got our training, we have a master dog program, and they try to get out into the community. They go into nursing facilities. They go to even some restaurants. They'll go maybe if there's a celebration in town like Jeep Fest, and they'll have the dogs down there.
Yeah.
She and I have been invited to all of that, but I try to keep her within the health system. That's her job.
Yeah. I love that. So your family's also involved in the training. You talked about that. So like when you first went, just talk about that a little bit, how that sort of.
Well, when I wrote the proposal to the administration, I sat down with my family and I said, I can't do this alone. If we're going to bring a dog into our home and work with her, we got to be a family and do it together. That way, her commands are all the same. We treat her the same at home like we do at work. We want to make sure that we're all on the same page. And my family was all for it. And, of course, my daughter, she was a little bit younger at the time, but her only request was that Henrietta could sleep with her at night. And but then when we started going to training, Lucy, my daughter, she was always on me. Mom, you're doing that wrong. Mom, you got to do it this way. And I was real glad about it. I mean, she kept me on my toes.
Yeah.
She was part of my training, Lucy. She made sure I did everything right because, I mean, when we got trained and we got certified, it was a celebration.
Oh, I bet. How old was Lucy when you started training with Henny?
Lucy would have been 15.
Okay.
She's only 16 now. Well, Lucy would have probably been like 13. Henrietta was only certified a year ago.
That's right.
But when we started, she was a puppy. So 13.
Okay. And that's another thing I wanted to bring up too. She just had a birthday, didn't she?
Yeah, she just turned 3.
How was your party? You said you were having a party yesterday?
Yeah, we had a party at Radiation Oncology. Our manager asked if we could have a party for her. So we had a big birthday cake, and we gave all of our patients cake yesterday. And we had signs that it was Henrietta's birthday.
Oh my gosh, this is so awesome.
Everybody, I mean, they sang, and we did have a heck of a celebration.
Yeah.
Henrietta got to even have a little piece of cake. I try not to have food around Henrietta when she's working because, food can entice a dog to be bad, and you don't want your dog to be wanting food. But yesterday was her day, and the patients loved it. They ate it up.
That's so exciting. What was the cake? Did it have like her name? Did it say happy birthday?
It said happy 3rd birthday, Henny.
Aw.
We call her Henny for short. And we got
Heni.
Yes, Henny. So we got a big cake at Penny's Bakery, and it had raspberry filling. And
so great.
Yeah, it was extra special for the patients.
Yeah, of course.
Mm-hmm.
Well, that's the thing. I mean, when someone's going through radiation and chemotherapy, I first of all, I've experienced it with family members, but I was young and they were, grandparents going through that. So I didn't ever experience that time. I wasn't there when any of that was happening because I was too young, but can imagine that can be a very lonely thing. And I'm sure it's hard for a lot of family members to possibly be there to see that. Mm-hmm. So having Henny and having these moments of like celebration and stuff, right? It's just, that's kind of what it's about, right? You just got to keep living life.
We do. And like, for example, yesterday, Dr. Anya Frey said, Stace, there's a patient in the room. So I took cake in, and I mean, he just had an exam by the doctor, and here comes me and the dog and a piece of cake with a fork. And I know he was probably like, what the heck is going
He's like,
on?
are you, coming with cake and a dog?
Yeah. Like, what is going on? I'm at the doctor's office.
Yeah.
But the key is truly, these are people.
Yeah.
These are not cancer patients. We treat them like people.
Yeah.
We have fun. We laugh. And we make the best of the situation. I mean, truly, we are a team there.
I love that. So what, if you could say right now, are there any goals you have for what you're doing now that you might want to share? Or any thoughts for, I don't know, I see something for you.
Well, you know what? I'm always up to something. But it's the truth. I'm always up to something. My wheels are always turning.
Yeah.
I honestly don't have a plan, but I do come up with stuff on a regular basis. If it hits me and I think it's going to make people happy, I'm all for it.
You know, you created something that didn't exist. You brought this program on your own. You, like you said, you jumped off the high dive. I feel as if you could build something out of this.
Thank you.
You know, like I said, the mentor, you could mentor other people to do this and expand your canine crew, you know? I don't know. That's kind of what I see. I'm kooky like that. I talk about energy and I talk about because I think time flies, right? I'm looking at this year and I cannot believe it's almost October.
Yeah, I know.
It felt like it was January yesterday. So if that's not a reminder of us, if not now, when? So that's kind of what I see. I think that would be exciting. I'm sure there's a lot of people possibly listening who would love to work with you or for you, or who knows.
I get a lot of people, believe it or not, after going through cancer that want to volunteer, come back and help. And so I do let them come in and do things for me. And, you know, it's their way of giving back.
Of course. Of course. I mean, that's got to be, those are some remarkable stories too. I'd love to talk to some people who have, because none of us knows. I did talk about this in last week's episode. It's like, we can't avoid that we're all going to die someday, right?
Right.
And unfortunately, when it comes to cancer, I think the first thing that someone who's diagnosed with cancer is, you know, you're like, okay, well, is this how I'm going to?
Well, you know what I always tell patients? This is your journey, and nobody knows when it's going to be your time. But the beauty is I see a lot of good things come out of this office. And so we're going to concentrate on today and focus on the good. Thank you.
You're welcome. I accidentally hit one of the other buttons too, so hopefully you didn't hear that one.
Okay.
It was like, and I was like, nope, didn't want to hit that one, just the applause. You're so wonderful. The way you speak, it's so eloquent. I can imagine someone feeling really safe with you and taken care of. And I think that's, I mean, I imagine anyone who works in oncology that's their mindset, right? Because they have to deal with it every single day. And yeah, you do see a lot of hopeful stories come out of this. I've talked recently with some people who, there's two different sides. One person, my really good friend Larry, his daughter, since she was 5, she's battled cancer. She's in her 20s now. She's still alive, but she still has tumors. They're not active, like on her spine and her brain. She, would love to go to college, but she can't. There's a lot of things she can't do. She has to have pretty much constant care. She has to have someone with her. She is a talker, but to a certain degree, she has a lot of goals. She just recently started taking ballet classes because they have a special lady in LA who works with kids or young people who have had, who have gone through cancer and have, aren't able to really, her legs are all atrophied. So she's taking ballet classes. That's something she wanted to do. And her parents were like, you're not going to be able to take ballet. And then they found this teacher.
Yeah. Like, oh, yes, you are.
And she's doing it. So, what else do you find, I guess, rewarding about what you're doing, especially like working with Henny? I mean, I think a lot of it you've already touched on, but I'm sure that as much as she's helped other people, I'm sure she's helped you too.
Oh, she's definitely helped me. It's kind of like going to church, and when you leave church, you feel better after you leave. And when she's around, she does make you feel special. When I'm in my office, she has her own bed. Well, and she also has the run of the office. But where does she go? Under my feet with her head on my lap. I go, honey, I know you love me, but don't you get sick of me?
Oh.
And she just wants to be so close to me.
Yeah.
And so, I have bad days at work too. I mean, we see a lot of hard stuff. We see a lot of good stuff. Mm-hmm. And she does make me feel better.
Yeah.
And she also helps the staff, not just the patients. But think about what everybody does at the cancer center. Everybody has their own role and their own piece that they have to do there. And so she helps them too.
Yeah.
I mean, she's just not for the patients, but she's for the staff.
Dogs are so amazing in how they know when you're like sad or in pain. My dog knows like instantly.
Oh, yeah. They want to be like a magnet on you.
Because they want you to know that you're not, it's like this, that you're not alone.
Now, Henny has a really cool way of showing people she loves them. She'll go up to them, and at first, like, she'll let them pet, and then she does a little circle, and she backs up into either their legs, or if somebody gets down on the floor, she'll back in and sit on top their legs. But that's always been her thing.
Yeah.
She backs up. And even when we went to training, my trainer, Matt, he would go, oh, my gosh, like, that's her. That's like her
like
own
her
signature.
Yeah. I love that.
Yeah, she backs in.
You need like a gif of her, like,
and
I got you.
People are like, oh my gosh. I do have to say, though, I have to tell people a lot of times, they all want to hug her. And her job is to stay on the floor. But she will try to hug you if you ask for one.
You had said that, yeah.
And she'll try to sneak a kiss because people kiss her and she kisses back. And so I have to remind people she's working.
Yep.
And ladies, they'll always go, I think I have a treat in my purse.
And you're like, nope.
No, we're working. I go, thank you so much for thinking of her, but no treats when we're working.
Yeah. Well, that's good because I haven't done so well with my dog, although he's not a therapy dog. But that little stinker, I tell you what, he's got me wrapped around his paws, that little one. But you did say that there is that difference. She knows, like when you're at work, she knows. And then when you're at home, she's almost like a little.
The light switch.
There's like a switch, right? And she's like, now I can play. And I'm like, so it's really cool that because she still gets the reward of like being a dog, you know? But that other part of her is part of, I think, what dogs are here for, is to help heal us and take care of us and just remind us to, I don't know, just be happy, right?
Yeah. Some days, though, she goes home and she just lays on the floor and it's like, I've had a long day.
Yeah.
And she just zonks out. And then other days she goes in and she's off to the races, running around the house like crazy.
The zoomies.
Yeah, the zoomies.
The zoomies, yeah. I do that with my dog, and he'll do one, and then he'll stop and look at me, and then I clap. And so everybody starts clapping, and he just continues to and he slides on the floor. It's just so funny, and they're just wonderful.
No, I just want to say thanks for having me today. This was fun.
Of course.
And I'm so glad that we got to talk about my girl and what she can do for our patients, because she doesn't understand the glory of what she does. And I almost wish she could understand it, because she has such a big role and doesn't even get it.
I don't know. I think it's really special what you do, and
Thanks.
just grateful for you. And I know there's a lot of people out there who are grateful for you as well.
Thank you so
for
much.
you and Henrietta, and I love that name.
Me too.
I think it's so cool. I just love it. But thank you for taking time and chatting with me beforehand. I know we had a bit of a conversation beforehand, and just for doing what you do.
Thank
So,
you. This was fun.
Yeah, thank you.
Have a great day.
You too.
Thanks.
Thank you for tuning in to Alter Ego. Join me every Monday for a new episode, and be sure to click subscribe so you don't miss a single episode. Follow us on Instagram at Alter Ego Podcast. Until next time, stay safe, stay hopeful, stay kind.